Okay, perioral dermatitis. What on earth is this? Hi everybody, it's Dr. Myers, Dr. Derm, coming at you not live with a little perioral dermatitis. Perioral dermatitis is an acneiform eruption that you get here around the nose and here on the pre-jowl, kind of underneath the sides of the lips. You can also get it in a periocular distribution. Perioral dermatitis is the main version, but the broader group is called periorificial dermatitis, which means you can get kind of this rashy, acne-like rash near openings, eyes, mouth, nose. And then periocular dermatitis would be a subset of it. We don't know exactly why people get this. We know who gets it, like we see this a lot more in women than in males, unless people are younger, and then it's about equal. We know things that can flare it, so we know that scrubbing it or being aggressive with it, or some toothpaste even, and certainly even steroids or topical hydrocortisone, that can end up flaring it and making it more entrenched and harder to get rid of. So when people get it, sometimes they're tempted to use some topical creams. And what topical creams do we have? We have cortisones, which cortisone is like weak corticosteroid. Hydrocortisone, 1%, it's over the counter. Well, it's great on many rashes, eczema, psoriasis, itchiness, even irritant dermatitis, a lot of different stuff. It'd help, not perioral dermatitis. In essence, it gives you this false sense of hope. At the beginning, it goes a little bit better, but then you are stuck using it every day. And if you ever stop, it flares up even worse. So you kind of keep doing it and keep doing it and keep doing it. You're almost like addicted to the hydrocortisone on your face. So to get out of it, you almost have to stop that and do another treatment, which I'm going to tell you about. So the very best treatment for perioral dermatitis is an oral antibiotic. What does that mean? Is this an infection? No, it's not. But these medicines have this amazing history of being not only antibiotic or killing bacteria, but they're also anti-inflammatory. So they have another aspect of them, like minocycline, doxycycline, and even like amoxicillin, cephalexin, penicillins, and cephalosporins, and even like macrolides like azithromycin. All of these will clear perioral dermatitis like magic. I can almost guarantee when someone comes in, we start these oral medicines, within a month, it's gonna be gone. It's amazing. And I love treating it because I know that we can get it gone. You can't like cure it. So sometimes people, a tiny bit trickles back in 6 months or 6 years or 1 year or 3 years. And so you can do a small amount of that antibiotic for a week or two if it comes back like in that 6 months or 10 months or 3 years or whatever. But at least you know what it is at that point, so you don't let it get out of hand, or you don't have to hang on to it for years, because a lot of people think it's acne, and so they're going after it with clindamycin or benzoyl peroxide because it looks acne-like. It's acneiform. They think it'll act just like a regular pimple, and it won't. So do topicals work with perioral dermatitis? Kind of. So if someone's pregnant or they're a baby and we can't use oral antibiotics for some reason, then we do have a couple topicals that kind of work. They're way slower, they're not near as efficient, but it's better than nothing. So we've tried some like topical clindamycin, even topical new JAK inhibitor could be tried, and there's even like sulfacetamide that could be tried, and other ones that I'm not thinking of right now because I hardly use a topical with this. But anyways, perioral dermatitis, or perioral derm for short, makes me happy to treat it because I know I'm gonna have a happy patient in mind. Hope that helps. Smash the like button. Thanks for watching. Take care.